Welcome back. We have hit 9:45, and so we're coming out of our closed and executive sessions. No action is a result of those closed sessions, and so we'll move into our 9:45 briefing with Jim Matson and Juvenile Court. Jim, are you with us?
Yeah, good morning, commissioners.
Morning.
So you may recall back on February 28th, I had briefed you guys on a electronic monitoring contract. We were going to be utilizing some of our JDAI funds, and I had mentioned that we would be receiving a few more dollars from that grant. And so today's briefing is on that grant. And so what it is, we're getting an additional $3,500 for the rest of this state fiscal year and as well as next year's fiscal year, and so brings up the total to 28,000, up from 24,500. And so I'm just asking that you guys would approve this so we could utilize those funds to provide electronic monitoring and some other services out of Juvenile, and get that to the action agenda, I believe on the 29th is what I'm going to shoot for.
Okay, great. Commissioners, any questions or feedback for Jim?
100%.
Excellent. I do as well.
Okay, thanks, great. Jim. Thank you.
Thanks, Jim.
Okay. And next up, we have, well, we're a little bit ahead of time for our updates from the BH ASO. I don't see Mark Freedman or Joe Avalos on with us yet this morning. Mark, do you want to maybe get started with support services or a couple of items, and then we can see when they hop on, we can shift gears?
Absolutely. Our team can get started. We're going to start it off with Jen. Our staff's super relaxed and refreshed and ready to present.
Tan, ready, and rested.
Almost glowing. Yeah.
Good morning, commissioners. Thank you, Mark. I'm going to share my screen if that's okay, to present the 2022 February financials.
Perfect.
Okay, so starting on page 2 of your handout, the current expense revenue. We have so far through February of this year received, and this is just in current expense, $4,518,131, and last year at this time we had received $4,644,172. So we are pretty comparable, a little bit lower. We're at 11% of our total budgeted revenue, whereas last year we were at 12%. It doesn't look too alarming to me at this point that we're a little bit lower. So any questions before we move on?
Weren't we actually high last year compared to the year before, though?
Yeah, I think that we were a little bit high last year. The main difference, I believe, is in the treasurer's department. So we'll go to that next. So on page 3 and 4 of your handouts, the total treasurer's revenue is at $2,211,428 so far through February. And last year we were at $2,365,116. And we're at 8% of our total budgeted revenue for the treasurer's office this year compared to 9% last year. But a big portion of that is the property tax payments are down this year compared to last. And I'm not sure exactly, if people were prepaying last year because of, stimulus money that they received, or, what the deal is there. Lisa Frazier might have some more insight into that. I'll check with her on that. And the other big thing was the DNR, whatever that is. The timber.
Line 50.
Yeah, we're at 50,000 this year compared to 117,000 last year. So that was a big difference. And then we had the refund that we do to the Public Works, to the road fund for road diversion. So we collect through our property taxes, the road diversion, and if we over collect, then we reverse that into the road department. Well, that reversal, the majority or all of it actually for 2021 happened in January, whereas last year I had done 2 different reversals. So that's why the big difference here. I had done the majority last year in December of 2020, and so January's 2021 transfer was rather small, whereas for 2021 the whole over collected amount was done in January of 2022.
I know that there are a couple of significant meetings coming up with DNR. I registered for a couple of them because, through WASAC, we're a member of the timber counties. So there are some concerns from other counties that I've heard. So hopefully we'll know more, but I've sent you an invite to that meeting.
Aaron, are you talking about that email we just saw? Because I've been curious as heck about that. If later on, could you give us a little update on that if you can? Because I was trying to figure out whether we're supposed to get involved or not.
I think it's a good thing for us to know, because we do have DNR trust lands, we are involved. So I think that it's important for us to know. So I'll have Jennifer, and I know Lisa's going to join us too for the meeting.
I can give an update on that to the commission at the next briefing. Okay, any other questions on the treasurer's revenue? Okay, moving on to the expenditures. So for current expense, total expenditures are at $6,530,737. This year compared to last year, we were at $6,089,329. In both years, we're at 15% of our budgeted expenditures. So everything looks okay there so far. Any questions on any of that?
Nope.
Okay. So moving on to the special funds 6-year recap. So the couple of things that we, or I'm sorry, it's not special funds, it's just different revenue sources that we have highlighted. So everything is kind of all over the place, it looks like, through in February of this year, with the property taxes being down. We've got community development revenue is still up, so that's good news. We've got current expense sales tax is up over the previous 5 years, and then everything else is up down here, except for the homelessness prevention filings is down a little bit. Any questions or concerns on this?
So the big dip in the county road tax is the same as the current expense property tax because they're both coming at the same time. Could you already mentioned it, but perhaps we can find out why this is happening, see if this is going to be something that's going to correct itself, or because before I was just thinking that it was because we received more monies last year because of the COVID issue and we gave a break on the taxes, but this is a big number not coming in. So I'm wondering if it could be simply just a filing date for, for the treasurer when they file something, when they put it through or something, because that's a big difference.
Yeah, and I don't think it's anything to be alarmed about, because we'll always get the property taxes, at some point within, like the 3-year period, whether it's through, people paying or, ultimately foreclosure, which is not what we want to do, but ultimately, the property taxes will always get paid. So
I guess that's why I'm looking at it, is to see if it is a precursor to give us a warning of something that's about to happen, like in 2007 or the like, when we had some downturns. If that's something to take notice of, that's what I'm actually looking to find out. If you don't mind looking back and just seeing if we had this happen in the past.
Okay, I'll take a look. Yeah, but that would be my guess as well, Commissioner, is that people prepaid with stimulus money. But yeah, I'll definitely check on that, and I'll let you all know for sure. Okay, so moving on to the county sales tax, page 7 of the handout. We have received in February $735,573. And compared to last year, we were at 705. So that's a nice jump. We're at 30,000 over last year in February. We have budgeted 7.2 million, and the projected revenue at this point is about 8.5 million to the end of the year, to the end of December. I did notice this morning that the revenue budgeted in 2021 is actually 6.25 million. So I'll update that for March's financials. 6 million was the 2020 number. I forgot to update that when I did January. So sales tax is looking good. We've budgeted 7.2 million, and yeah, are projected to bring in about 8.5. So questions on that or comments? Okay. So on the 6-year financial recap, page 8, we have current expense cash. We have $19,789,226 at the end of February. Compared to the previous 5 years, we're looking really good on our cash. I mean, we never want to get down to, below 2 million where we were in 2017. So we've done really well with our cash. We're at, again, 11% of our total overall revenue that we brought in through February, and 15% of our total expenditures expended out through February. And we're right in line with the previous 5 years on both revenue and expenditures. And on the special and other funds, the cash balances, we have a total of $40,802,755. And, that's, again, much higher than the previous 5 years, but a big portion of that is the $5 million that we have in the new American Rescue Plan Act that will be expended. But even taking that into consideration, we still are looking good on the cash balances.
And Jennifer, that 5 million is actually related to last year's distribution of the 6.4, right? People just haven't actually got reimbursed, or we haven't distributed the money yet.
Yes, that is correct. So,
Because
yeah,
in June you're going to get, yeah.
Yeah, any other questions or comments?
Lodging tax is doing good.
Yeah. Okay, so moving on to the motor pool summary, which is page 10 of your handout. We are at $216,703 total expended, and we're at 14.41% of our overall budget, the benchmark being 16.67%. So we're looking okay there, even with fuel prices as high as they are right now, that we hadn't accounted for. The huge jump, we're still looking okay so far, but we most likely will be bringing forward a budget amendment for fuel if it continues to be as high as it is currently later on this year.
I bet it goes even higher.
So yeah, any other questions or comments on the motor pool?
Nope.
Okay, thank you. So moving on to the special funds revenue we're at $7,418,422 through February, compared to last year, $4,939,015. This year, we're at 10% of the total revenue budgets. Last year, we were at 11%. And I have not had a lot of time to analyze this, or I haven't taken a lot of time to analyze, the $3 million difference, or close to $2.5 million, I guess, where the differences are. So any questions or comments on this?
No.
Okay. So the last page 12 of the handout, is the special fund expenditures. And we're at $8,371,586 through the end of February. Last year, we were at $8,086,054. We're at 10% of our total budgeted expenditures this year, compared to last year, 16%. Questions or comments on the expenditures?
No.
Okay, that's all I got. Thank you so much.
And for a little pat on the back, I had a conversation with Mark regarding our budget here just recently, and it came to my mind how I used to have to look at things in this giant block in order to budget things out and keep the money separate in my head. You've done such an incredible job. We all have such a direct line of each individual account because of the thing that you put together. People don't remember, we didn't used to have that. That's something that you brought in and changed us forever, I think. I think we'll always expect this from now on because it is such a wonderful tool. So thank you.
Thank you. That's my goal, is to keep it straightforward and transparent. So thank you very much.
Thank you.
Great. So I just, Mark and Joe didn't have the Zoom link, so I just forwarded that over to them. Maybe we could just do the Mason Journal item next, and it should be pretty straightforward.
Morning, commissioners. So it's time to adopt the resolution declaring that the local newspaper is our official newspaper. It has to be done every April.
Sounds good to me.
Support?
Yep.
Great. Okay, I see Mark has logged in here. Mark Freedman. Just give Joe another minute, and then we can hand things over to them.
Good morning.
Morning, Mark. Okay, and I see Joe has also entered the Zoom. So commissioners, this morning we have with us Mark Freedman, CEO of the Thurston Mason Behavioral Health Administrative Service Organization, and Joe Avalos, who is the administrator for Olympic Health and Recovery Services. I thought it was a good time to bring them on to provide some updates to the commission on the work that the organizations are doing in Mason County. Of course, behavioral health is front and center on all of our minds and a lot of our constituents' minds. And so we've increased and expanded service and reach in the county, and we're always looking for opportunities to continue to improve. And so just give Mark and Joe an opportunity to run through some of their programs and updates, and I'm sure if you have questions, they'd be happy to answer them. Go ahead, Mark and Joe.
Thank you. If I can share my screen here, we've got a PowerPoint that we can run through really quickly. Make sure this works.
And I'll start off just simply, is there any specific question right up front that needs answering?
Not sure.
Are you guys seeing this, everything on this?
Yes.
Yep, looks good.
Okay. All right, Mark, go ahead.
You want to scroll down to the first slide?
Yep.
Good morning, commissioners. Mark Freedman, with Thurston Mason ASO and Joe Avalos with OHRS. It's the same agency underneath the BHO LLC, but we've had reason, more than had reason, we were required to sort of separate out the two entities. So while we work hip to hip, we are two different DBAs, two different entities to the state in conducting the ASO being the administrative branch and OHRS being the service provider branch of the organization. What we have on the first slide is we start with history, letting you know where we came from. Joe has warned me not to go back to 1989 when all capitated managed care for behavioral health started.
Yep.
But if there are old questions, unfortunately, I've been working back then and we could answer some of these for you still.
And actually, maybe before we start, Mark, it'd be good to know how much time do we have for this presentation?
I think we had you blocked out for about 15 minutes, but
Okay.
we certainly have some flexibility if there are good conversations happening.
Okay. Excellent. So the Healthcare Authority or what was Division of Behavioral Health and Recovery under DSHS wanted to integrate initially mental health and substance use treatment services, and then eventually move to full integration for combining for Medicaid, combining primary care and behavioral health care. And so at that time, the Regional Support Network, which had become the BHO for the combined mental health and substance use, we have the Medicaid funding we had at that time, which was around 60 million per year, was recontracted by the state to for our region to 4 managed care organizations. So that began for us. We held that as long as we could till January 2020. We there's different terms for were we late adopter, early adopter, but in the end, that's when we transferred over where what was the behavioral health organization became primarily a crisis service organization. So the 4 managed care organizations that had already been in the region now became both primary and behavioral health funders for services with the same contractors that we had been contracting with. And those 4 MCOs are Molina, United, AmeriGroup, and at that time, Coordinated Care for just foster care children.
I want to point out here, Mark, that I think it's important to note that historically, we always had all five plans in the Mason County region and Thurston County region. So it was a big change losing Community Health Plan of Washington, as well as Coordinated Care for adult services. It meant that people that had those plans had to get off of those and switch over to one of the other MCOs that did win the RFP for our regions. So I think it displaced several thousand folks from having
because CHPW was a big provider in the region at the time. The interesting side of this is recently the state reopened up which MCOs could operate in our region, and now all 5 are back to operating. So CHPW has been able to return just recently, but an awful lot of clients went through, as Joe said, sort of whiplash of having to move away from an MCO and away from the BHO, which was providing behavioral health care for quite a few individuals. So in January 2020, our funding was reduced considerably. On the Medicaid side, that all went, except for a small portion, to the MCOs. And then our non-Medicaid side, which funds those services that Medicaid is unable to fund, we were reduced by 20%, which also went to the MCOs with the idea that there were some services that needed to be combined with Medicaid services that Medicaid could not fund. So if an MCO was funding an evaluation treatment facility stay, Medicaid does not pay for room and board. So they needed some non-Medicaid to cover those services. So we, as had become an ASO, we were then providing and funding still crisis services. And we had a contract also with the MCOs for crisis services for the Medicaid client. We were funding the involuntary treatment courts, which we had 5 at the time. We fund involuntary hospitalization for non-Medicaid individuals. And we have, as required by contract, a Western State Hospital liaison, and we're serving certain priority populations for non-Medicaid outpatient services, such as pregnant parenting women, injecting drug users and such. And then there were other services that we would fund as funding was available, such as voluntary inpatient and detox services, et cetera. Next slide. So when we moved into changing our network around, we still pretty much held on to most of our providers, but on the non-Medicaid side. So we have contracts with 25 total providers, 18 of which are behavioral health agencies that we still manage in 2022. So the idea that some of this integration was to reduce administrative load, both the state and us, it essentially did not accomplish that. So the state has still multiple contracts they have to manage, including with us, as well as the MCOs have to manage a bundle of contracts, and we manage at least 25 providers. We also have contracts with multiple community hospitals, that including Providence, South Sound Behavioral Health, Fairfax, and Smoky Point, and contracts with secure withdrawal management and stabilization services.
Yep. And I think I would add here, Mark, that for the provider, it got difficult as well. So we added new directions from Mason County as a provider this year, but historically they were not a Medicaid or non-Medicaid provider, primarily because, so now in 2020, whereas in 2019, it was one contract with the BHO for all Medicaid and non-Medicaid services. In 2020, it became, if you're an agency, you've got a contract with all 5 MCOs plus the ASO and then 5 different reporting, 5 different ways you're sending claims in, and also different reimbursement rates as well. So while it might have been integrated on the state level, it certainly was not so on the provider agency side. So that certainly has been a challenge ongoing into this year as well. So
yeah, the providers, and that's a major issue that they like to talk about, is the complexity of having to have that many different billing arrangements that for them to be funded for services provided. And when it was just the BHO or the RSN, it was one entity that they had a contract with for both Medicaid and non-Medicaid. So yeah, their administrative load went up considerably.
okay, so part of our transition over into the BHO and ASO land was to create our own agency at the direction of our governing board. So we did that in 2017. And so we have the same governing board, 2 Thurston County commissioners, 1 Mason County commissioner. And really our focus and our mission is not to do traditional outpatient or inpatient services. It's really about providing that safety net and really trying to focus on catching the folks that slip through the gaps. It's incredibly tough, but it's a huge issue in Mason County and Thurston County, actually statewide. And so we felt that we would be able to, if we focused on that and did it well, we would be able to link folks to the right resources throughout the region. And so we've been doing that slowly but surely over the last 4 years. And we focus specifically on 3 main
Well,
area.
Joe, can I just step in quickly?
Sure.
In the mention of the change of the governing board was a significant revision for us, for all of us, where when we were the RSN, we were under the essentially the administrative responsibility of just Thurston County. And when we integrated mental health and substance use, we also changed our structure where instead of being under one an extension of one county for administration, we essentially became a standalone entity with a combined governing board of both Thurston and Mason County. So structurally and emphasis changed considerably 2016 for us all in terms of the role that Mason County now plays with our organization on both the ASO and OHRS side. Okay.
Yep. Thanks, Mark. So the three areas that we focus on are crisis service, jail diversion, and hospital diversion. And I'll just go quickly through what we each of those do. In the crisis service department, that is one of the tasks that we do receive Medicaid funding for. And so we're to provide a 24/7 crisis hotline, a mobile crisis team, and crisis stabilization, as well as we recently started some law enforcement co-responder programs with Olympia and Lacey Police Department. And then finally, the designated crisis responders, or DCRs. And so these are the individuals, the mental health professionals that can detain someone for an involuntary commitment due to a danger to self, others, or because they're gravely disabled due to a mental health or substance use disorder. So we've been doing that since about 2018, slowly but surely expanding the team into this year. And I will say that still, I don't think that we are at, I don't think we have enough folks yet still. I still think we need more FTEs. And as we keep adding, we keep finding that we just keep doing more services, and still, I don't think we're at a baseline yet, unfortunately. I will say that I also think that the need has grown over the last few years as well. We just haven't been able to keep up so much. For the jail diversion services, we have had a True Blood grant for several years now, and we expanded it last year into Mason County. We've got several contracts with the various jails in Thurston County Correctional Facility. We're in Mason County Jail, Olympia City Jail in 2021, and then we are intermittently in Mason Juvenile Detention as needed. The jail diversion program also hosts the lead and recovery navigator programs, which I'll talk about in another slide. And then also the Mason County Rural Counties Opioid Response Program, that's RCOR, some reentry, and also Mason Navigator programs, which I'll talk about in a bit. And then finally this year, we did win an RFP to do the in-house jail chemical dependency program in Thurston County. The last area is the hospital diversion services, and this is where we talked about the Western State discharge planning. So folks that are exiting Western State that belong to Thurston or Mason counties, it's our responsibility to reincorporate them back into the community, providing support through peer bridgers, which are folks that are with lived experience to help folks get back into the community. And then finally with HARP, so that's the housing and recovery through peer service. This helps with a stipend to get folks into affordable housing or back into an apartment or into recovery housing as available. More specifically with the jail behavioral health team in Mason County Jail, we have a lot of contracts with Mason County Public Health to have mental health professionals embedded in the jail. That's Michelle Stacy, who's in Mason County Jail, and I heard from Chief Hansen, I don't know if he's on this call or not, but that she was up for an award, which is fantastic. She's been there for several years now and has been an integral part of the mental health system in Mason County with the jail. Our RCOR program has a substance use professional that helps with the needle exchange and helps do assessments in North Mason and in the Charlton area to get folks into treatment. We also use peers in the jail and in the community as well to again connect folks back to the community as they're exiting. And we have the staffing levels there here. So we've got one mental health professional, an STD, a substance use disorder professional, apologize for all the acronyms, and then 1.5 us peers with lived experience that are doing this work here in Mason. A big change that came this year, it was the Law Enforcement Assisted Diversion, or LEAD program, and the expansion of the Recovery Navigator program. So the LEAD program was a joint effort by Mason County Public Health and OHRS. It was a grant through the Healthcare Authority that we won in 2020. The point of that program is a low barrier harm reduction approach to connect individuals in the community, divert them from arrests and for low-level substance use disorder violations, and connect them to treatment supports, housing, etc. The Blake decision that happened in 2020, I believe, kind of changed that for us when possession no longer became something that could be arrested for, or at least prosecuted for. So the part of what happened with that bill is there was funding input to expand or start a Recovery Navigator program to offer support and treatment for these individuals who would normally have been arrested and offered diversion services. In Mason and Thurston counties, we chose to, instead of creating something new, we wanted to go ahead and expand the LEAD team. And so we've done that. It's one team. It just has 2 fund sources now, and it has allowed us to double the staffing in Mason County. Again, they meet people where they're at. We're at Community Lifeline a lot. We are in North Mason County. We are engaging individuals that have substance use disorder issues and are trying to connect them to the right services. I think the last meeting last week, I heard that we actually are very, very close to full caseloads for everybody that's on the team. We are still in the process of recruiting a couple more FTEs. I think we need a substance use disorder professional and a peer because the need is just there as well. I think we have over 40 people enrolled in the program right now. We also have a funding for a navigator, a behavioral health navigator that is stationed at the Mason County Sheriff's Department and splits time with the Shelton Police Department as well. That person is integral in having a direct linkage between law enforcement and connecting individuals to any of the programs within OHRS, to include crisis services and the LEAD teams. So happy to take any questions along the way, by the way. If, I know I'm kind of I'm aware of the time and trying to get through kind of what we've got going on here and make time for questions. We have had some challenges over the last couple of years. Obviously, COVID was a huge issue, and it did lead to a big increase in crisis calls to our agency. We are unique in that we run the 24/7 line with the same individuals who would respond as mobile crisis teams. We are the only agency in the state that does this, but we find that it is the best practice because the person that makes that initial engagement on the phone may very well be and is often the person that goes out on the outreach. So there's a connection there with the referral source, whether that's a family member or the person in crisis themselves. The challenge we faced with COVID, obviously a lot of traditional services provided by the agencies in the region stopped and became telephonic only. So that led to increased calls for us. And we've kind of stayed there. We're about 2,800 calls per month, which is a big increase from when we started the ASO structure in 2020, in January of 2020. So that continues to be an issue for us. Mark, I don't know if you want to talk about the workforce shortage.
I think we're all pretty familiar with what's going on statewide, but we keep prompting the discussion of it with Healthcare Authority and the legislature, where it was a legislative priority for 2022 with WASAC, and will continue to be a priority as well.
Inpatient billing, that's more on the ASO side, and that just makes it difficult to project with budgets, as hospitals now have to contract directly with us for reimbursement. And that was not the case prior to 2020 that went through the state. So that is a challenge for us because they're giant corporate systems that frequently they're not going to send you a bill within 30 days. And so that does make it challenging for us at times. House Bill 1310, won't belabor that issue too much longer, but it was a huge issue for us in 2021. and led to about a 20% reduction in our ability to do involuntary treatment investigations. Very frustrating for the community, for law enforcement, and for the designated crisis responders. We are hopeful with the passage of House Bill 1735 and House Bill 2037 this session that we can resume more business as usual. I know we've had communication with the Sheriff's Department about their ability to assist with ITA investigations. And just real quickly, when we're going out as a DCR, typically we need law enforcement there to assist, to just be there as backup, safety. A lot of times the folks in the community can be agitated and can, it can be threatening at times, not very often, but it can be at times. So safety is paramount for our staff, for the community, and of course law enforcement. So we anticipate a change of that very soon. Actually, we started to see it already since the governor signed 1735 a couple weeks ago. And then Mark, court costs.
Court costs have been hampering us forever. It became originally, when we had one court operating, it was manageable, but now we have 5 courts operating with the potential of opening up 3 more. And right now it takes 42% of our general state funding that's intended for treatment services that goes to legal costs to operate the courts. We've been pushing this as an item. It was a legislative priority this past year, and it's going to be one that's for this future session. We're already involved with WASAC in setting 2023 legislative priorities to include, again, looking at funding of court costs and not having it reduce what funding we have available for treatment money.
Yep. I'll add that in the latest budget, the Healthcare Authority was directed by the governor to work with the ASO system on establishing a methodology for court cost reimbursement. So that was a win, and hopefully, I think we're going to be heavily involved in that as it does really impact our system, our regional system.
My fear is that the result of this past session was that there will be a study, and I'm not sure if that ever spells something positive in the end, if we really want some action to take place. But
well,
okay.
I'm going to be optimistic about it because it's at least the first time that they've actually addressed something with the court costs. Usually they like to put it to the counties, quite honestly. So
Yes,
the fact that they are acknowledging it, that it's an issue, means they heard something. So
we try to make a lot of noise. We sort of are impacted by this more than any other region because of the bloom of the number of courts we have operating. Okay,
so we have got some current and upcoming projects. We'll go through these a little bit quickly. We did receive an initial or one-time only COVID enhancement funds, which we hope will be reinstituted in 2023. But for now, we completed an RFI, put out $600,000 to the region. This is what helped New Directions come online, as we did give them some of this funding. I think almost $250,000 of this funding for specifically to provide substance use disorder services for the non-Medicaid population in Mason County. As Mark mentioned, we have Community Health Plan of Washington and Coordinated Care back in the region now for all services. So that's a win here, although it will mean some challenges for the agencies who now, or who didn't have an agreement with CHPW, now have to get an agreement with CHPW and learn how to bill them and send the data and all those fun administrative pieces. We applied for a grant through the Seattle Foundation, and this is also the entity that funds the True Blood program. They had some funding available, and we asked to purchase 3 single-family homes. Actually, we asked to purchase 2 single-family homes for True Blood class members, recognizing that housing is a huge issue for every population, and in particular the behavioral health population. They awarded us 2, and then asked us if we could purchase 1 more, if we had enough, because they had money left over. So we said yes to that. We will be looking for 1 in Mason County and 2 in Thurston County over the next few months, and we'll have an update on that as we get closer to that. We also received some funding for a new co-responder program with Thurston County Sheriff's Department. as we already had something with Lacey and Olympia going. I think the Sheriff's Department in Thurston County was a little jealous, to be honest, and wanted to have their piece too. It's great for us. It's a good partnership, and their TST funding allowed for this to expand. Mark, you want to talk about the long-term civil commitment?
Well, just quickly, we had the existing facility that's called the triage building, though it's really a short-term involuntary treatment program, the one next to the ARC, the jail in Thurston County. That was 10 beds. It's not efficient to run a 10-bed facility. You can still use Medicaid for up to 16 beds. So we applied for to expand that facility by an additional 6 beds. Those will be identified as long-term civil commitment beds in the facility, but it'll still be one organization managing then all 16 beds. And hopefully that'll be finished this coming fall if the supply chain doesn't totally take a dive. Okay.
And then quickly,
Mark, do you have a, so I'm sorry to interrupt you, but Mark, do you still have access to the one by St. Pete's?
The voluntary facility at South Unit?
Yeah.
It is, again, it's only for voluntary, it basically is for self-pay. So
Okay.
while technically we have access, it's not an involuntary program. It doesn't help us. And that leaves an awful lot of people sitting on what we call single bed certs at Providence. Basically, they're sitting in a medical bed because we can't find placement for them. That's a whole long discussion we'd be happy to have whenever.
okay, House Bill 1477 passed last session. That was otherwise known as the 988 bill. So this 988 phone line coming for behavioral health crisis is, I think it's coming July 15th of this year. We'll have more information on that as we get a little closer to it. There's a lot of work that's being done with this. But one of the things that's coming out of this is a mobile crisis and enhancement funding specifically for youth. And so we are working with Catholic Community Services now on how they're going to incorporate this extra funding and expand services in Mason and Thurston counties. They'd already been doing youth mobile crisis for us regionally, but it was kind of on a smaller scale. So this is a welcome enhancement funding to allow for more services to the region and specific to youth. And then a couple more. I think this is the last slide, Mark. We've got the one we're really excited about it, the HOST program. This is the Homeless Outreach Stabilization Program. This will be a partnership with OHRS and Providence, and essentially is it's a community-based model to provide assertive treatment, where we will have mental health professionals, substance use professionals, peers with lived experiences, meeting folks in homeless encampments or where they're at in the region who are traditionally very difficult to serve, and bringing the services to them: case management, peer support, behavioral health support. And then the new addition is that there will be medical support as well. So Providence will be providing the RN and also ARNP for prescriber services. They're also are donating a van, or I'm sorry, not a van, an ambulance that is going to be kind of retrofitted to be able to go out to these encampments. And so this team will go out across Thurston and Mason counties, meet folks in the encampments, and provide service to them, connect them, vaccines, wound care, access to getting them on Medicaid if they're not in the system already. And then, of course, the end goal will be connecting them to the right resources. We've been doing this for a while in Thurston County, or at least without the medical side, and it's been very difficult to engage some of these populations. They are very tight-knit communities. They do not like to leave the encampments, and so having a program like this, which will bring things to them and get them healthy and stable as much as we can while they're in the encampment, and then hopefully, with the end goal of moving them more towards long-term housing, getting them in traditional behavioral health supports, and just keeping them safe and stabilized. So there's only one of these programs in the state right now. It's run through Downtown Emergency Services Center in King County. And then our region was chosen along with 5 others in the state to start rolling this out, regionally. And we expect that this will be a statewide initiative probably in 2023 after the initial 5 counties have kind of rolled out the service. So we're excited about that. We're hoping late summer of this year, if not early fall. I think on the OHRS side, we're going to be ready before Providence is. It's a little tougher to recruit nurses and ARMPs that are passionate about serving this community. Not that they're not; they just have a lot more choices, and sometimes being out in the field is a little bit different. It takes it's just a different approach. So we're excited about that, and we'll certainly have an update on this as we get going on it. And finally, Mark, ILS.
The interlocal leadership structure. We have more than multiple meetings with service providers and other community entities involved with delivery of care and how the system is operating, particularly for crisis. This is one, the ILS is intended to provide a communication avenue, not so much under that we're providing a particular service, but to give an opportunity to providers to talk directly to managed care organizations. So we want to get this off the ground. It's no longer a requirement, but we want this operating come this summer, where we could have a meeting with MCOs chaired by Thurston, from our governing board, and have the providers able to meet with all these entities so we can have a comprehensive system discussion, particularly to look at what's not working, and certainly, obviously, happy to address what is working. This is an avenue where, say, the complication of having for a provider 5 different billing methods because the 5 different MCOs can be discussed, as well as is there any actual integration for clinical services going on in the community to advance care for Medicaid population for behavioral health and primary care. So that's something we're looking forward to getting underway. All right.
Great. I think that's all we have. Happy to take any questions.
Thank you so much for the presentation and the updates. I guess one other thing to mention is we are moving into one consolidated location in Shelton.
Yes.
For staff, which will also be able to see clients up in the plaza that has Les Schwab in it in town. And then there's also an office in Belfair. So maybe you can touch on a couple of those things.
Yeah, absolutely. So we are already in the facility. It was the former Planned Parenthood office. So that's where we're at now. And the lead team runs out of that office, as we have also have when the crisis team is in Mason County, they're stationed there, their base is there. Yeah, we're there. We've got about 3,200 square feet there, and it's a good fit for us. And so we're now there every day. And then the North Mason building, it is a smaller office, but we are there primarily for the RCOR outreach. And then the crisis team will go up there as well whenever we have North Mason business, although normally they're out in
the community. Yeah.
Yes, and Tahuya. Did I say that right? Yes.
Yes, you did.
Okay.
I'm from North Mason. I just appreciate the heck out of the fact that you're actually there. Thank you.
Yep. And we and you guys have a great new firehouse coming, or fire station going out there. We met with Chief Bakken and Abe Gardner out there and got to have a tour of that, and it was fantastic. It looks amazing. So good work there for sure.
Yeah, we're really happy about where we've come the past, 4 to 6 years in terms of expanding parity of services in Mason County and making sure we have a presence there to, in this case, to deal primarily with crisis services. So we've come a long way from the old days where everything had to travel out of Thurston to get to Mason.
Sure.
That's changed.
And one of the things that we'll be working on this year, North Mason specifically, it's a little tricky because as we met with Chief Bakken, he explained to us, and we kind of knew this already, that a lot of the folks receive services actually in Kitsap County, and which is a different region than what we fund. So communication with them and coordination with their provider network and their hospital is going to be key for us, especially with things like the host program and some of the other ones that we're actually needing to access some medical services for sure.
And I'm sorry, when we mentioned opening up new offices and new services, I forgot to mention that we also have the new 32-bed facility there in Shelton, the involuntary treatment facility. So that's also a considerable change.
Great. Commissioners, any questions for Joe or Mark?
No questions, but just a quick comment. I want to thank you guys for everything that you're doing. There's definitely a need, and I'm glad that it's being addressed. So thank you.
Yes, thank you.
Our pleasure. And we look forward to continuing to do this and to try to meet the needs in Mason County. So thank you for the opportunity.
Thank you.
Excellent. Well, thank you so much, Mark and Joe. Just appreciate you taking some time this morning, and appreciate the updates, and we'll keep after it. Thanks, guys.
Thank you. Thank you, commissioners. And Mark Neary, nice to see you again. It's been a while.
Yeah, good to see you too again, Mark.
All right, now to figure out how to get off.
That's the $1 million question, Mark. Thanks.
Yes.
All righty. Very good. Okay, Mark, back to you.
Great, thank you. We're going to jump right into, do I have John Taylor with me to talk about the public meetings that you have for the Sandhill Park? Or Diane, are you going to take care of that?
I'm going to, because I think John's having problems with audio. John prepared 2 resolutions for the Sandhill Park project and then the Union Community Park. And he wants to hold community meetings up in those areas first part of April. So we have a news release for next week's agenda.
That's cool.
Sounds good.
Okay.
Okay.
So we're good with that. And then I wanted to go back to, I had on there the commissioner meeting schedule. We're good to continue Tuesday meetings every other Tuesday for the time being.
I'm good.
Same. Okay.
Okay, we're still remote until they change something. And then John did have on there, I see, for the lead pay for staff. And I did call him. He is asking that we have Tammy and Bud on till April 1. And then he may come back on Bud's. But in the meantime, since we're well into March now, and he's been using them both as leads still, can we have their lead pay go till April 1?
I'm good.
Same.
Thank you. And I'll put that on next week's agenda so it's clear for payroll. Thank you.
Thank you, Diane.
All righty. So I'm gonna ask if the board minds if I move around a little bit. I had asked Deborah to come and give us a legislative update. Deborah, are you prepared to do that?
I am.
Yeah. Okay,
Yes.
Great. Let me see if I can't pull up your slides. I thought I had them. Why don't you go ahead and start
Okay.
talking, Deb, and I'll.
Okay, sounds
Okay.
good. Good morning, everyone. Nice to see you. Deborah McGuire, contract lobbyist for Mason County. And I just wanted to give you a quick update on the legislative session that ended on March 10th. I know time is short, so there's a lot of slides here. I'm not going to go over everything that's in the slides, but if you have some questions about anything, please stop me and ask me, and I'll answer as best that I can. So when Mark pulls up the slide, you'll see the agenda, and basically I'm going to give an overview of the session, talk about the budgets, some of the key policy issues, Mason County specific projects, and then looking ahead, and then the 2023 session. And so with that, oh, great. Perfect. Just adjust this. There we go. Okay, great. Thank you. So for the 2022 session, that was the short 60-day session, but man, they did a lot in that short session. They really tackled some big policy issues, and the supplemental budgets that they passed were huge budgets. Thanks to, on the operating side, we had a much better revenue forecast than had been anticipated. Plus, we had a lot of federal money, ARPA money from last year, and the new IIJA money. And so, and they were able to move some of that operating money around into the capital budget and into the transportation budget. So we had really big budgets, even though it was a supplemental budget year. Probably one of the biggest things is the Move Ahead Washington transportation package, which is the first time since 2015 that the legislature has adopted a new revenue transportation package. And back in October, November, nobody thought that that was going to happen, not even the chairs of the transportation committees. And so it was a big deal, and we can talk about more details on that in just a moment. So the governor has 20 days to sign the bills, and minus Sundays. And so he's already assigned a lot of them. And if you have specific bills that you're interested in, let me know, and I'll let you know when that bill signing takes place. And for the 2022 session, again, once again, it was mostly remote because of COVID. And they continued to address COVID recovery, still looking at homelessness and affordable housing. They had some climate goals that they wanted to meet. And then there was, on all three of the budgets and the policy bills, there was continues to be a really strong focus on investing in underinvested communities. So on the next slide, the 2022 budgets, again, on the near general fund, it was a $64 billion appropriation, which is $5 billion more than last year. And they're going to have healthy ending fund balances. The budget stabilization account is in good shape, and in really good shape in the following biennium because they do a 4-year outlook. In the capital budget, they did $1.5 billion in appropriations for the supplemental. And then in the supplemental transportation budget, they really focused on backfilling some of the big Connecting Washington projects, which is the transportation projects from the last transportation package. Investing some more money into ferries, and then preservation and maintenance. And then, of course, the Move Ahead Washington transportation package is a 16-year package, and it's almost $17 billion. On the next slide, operating budget. I'm not going to go into all this detail, but you can see some of the big chunks of money. If you have any questions about salmon recovery or housing and homelessness or behavioral health, you just had a long discussion about that, and they're put a lot of money in the operating and the capital budget into behavioral health services. And if you can let me know, give me a sense of the areas where you're looking to see where there might be grant opportunities, that will help, because there are all kinds of grant opportunities that are being built into the budget, from EV charging to solar grants to growth management planning to behavioral health grants, things like that. So just let me know. And then on the next slide, the capital budget. And again, please stop me. And I can't really see you on my screen, so just shout out if you have a question, and let me know. But on the capital budget, again, a big chunk of that went into affordable housing and homelessness. They did $300 million for rapid capital housing acquisition. That includes the $60 million for the new Apple Health and Homes program that was created in Representative Chop's bill, $114.5 million in the Housing Trust Fund. They, excuse me, $72 million to expand facilities for crisis stabilization, which is desperately needed across the state, and $120 million for Public Works Board. My understanding of that is that's new spending authority, but not new money. So I'm not exactly sure how that works, but I'm sure we'll get more detail on that. And then $40 million for curb and $100 million for broadband. On the next slide, the new transportation package, there were 3 transportation bills, the supplemental bill, and then for the current law, and then 2 new law bills, one for resources, one for spending. On the spending bill, there's two buckets of money in that particular new transportation. There's Climate Commitment Act money, which is money that comes in from the new cap and invest system that was set up by the legislature last year. Revenues on that auctions are supposed to start next year. So we should see revenues on that. And then the first of those revenues goes into the transportation budget. And then there's like $5.5 billion of that money that's assumed in the 16-year package. And then there's the 18th Amendment and other revenues piece, the new fees, new revenue that comes in from the new fees and the gas tax and things like that. And so you can see some of the big things that the legislature is going to be spending that money on. And they're also going to be, they put $20 million of that money into a new rural roadway departures program, which I know is important to the county. I believe it's $1.25 million a year over 16 years. So it's up to $20 million. So there could be some opportunities there as well. On the next slide, key policy issues. They did pass an Open Public Meetings Act bill, House Bill 1329, and House Bill 1056 was the County Association's priority Open Public Meeting Act bill. And what they did was they just meshed in 1056 into 1329. Governor has not signed that bill yet, so we'll see if it makes it through in its entirety.
Could you explain that one a little bit more, please, a little in more deeper detail?
Sure. So it allows public agencies, so state, local government, others, to conduct fully remote meetings or limit attendance to those meetings if an emergency is declared. And it doesn't just have to be a statewide emergency, it can be a local emergency. However, you must allow the public to be able to listen in real time. It also requires you to take public comment if you are taking final action on something, unless it's an emergency situation. You can accept oral testimony or prior written testimony in order to meet that requirement. And you are also required to give the public an opportunity, if it's feasible and they request it, to comment remotely. And it also will require you to post your agendas online. So, I mean, in a nutshell, those are the big elements of it. But if you have more specific questions, I'm happy to talk with you about that.
Commissioner Netherland, I think that we're pretty good at doing most of the things that are outlined in this bill, and definitely discussion for the board as we move forward and continuing to allow alternative testimony as opposed to just having everything in person. But maybe getting back to some in person, but how do we mesh those together, I think is a good question for us.
So let me know if you have more questions about that. And I know that the language of the bill itself is a little convoluted and doesn't, in some places, can seem to not make sense. So if you have questions, just let me know.
Oh, you did good. Thank you.
And so on climate change, House Bill 1099 was the big bill. It did not pass at the very end of session. It was interesting that there was that was the bill that would have added a new goal to the Growth Management Act to address climate change. It came out of the House and went over to the Senate. The Senate changed it drastically. They disputed it. They went into conference, and the conference bill came out, and it included another bill that was put into it, House Bill 1157, that had to do with housing density. And in the end, they just ran out of time and it didn't pass. But I do expect that bill to come back next session. I also expect to see more bills. You'll see the last bullet on there on housing. I expect to see more bills about denser housing, more affordable housing. A lot of those bills really affected cities, but there's also county elements in some of these bills as well. And then you heard a little bit about the police reform bills that the governor's already signed. The one police reform bill that did not make it through to the end was Senate Bill 5919, which primarily addressed vehicular pursuits. There wasn't going to be agreement on that. And so that bill did not pass, but we're hoping that the bills that do pass will have clarified things, and they will help law enforcement do their job, in addition to community caretaking and giving a definition of physical force and things like that. And then, so anyway, so if you have any questions about any of these bills, just please let me know. I'm trying to be mindful of your time. And then on projects funded within Mason County, in the capital budget, we have a fabulous delegation, by the way, in the 35th. And so they just really have done a great job. And if you didn't get a chance to watch the floor speeches for Senator Sheldon, I encourage you to go back and look at that. I can send you the link if you want me to. It was really, really nice. And so for the capital budget, we did get $550,000 for the Russellwood water system upgrades. And so that is awesome. And then there are a number of other things that Mason County, projects within Mason County that got a benefit in the capital budget. I can't really speak to the details of all of those, but I wanted to list them for you so that you could see them. And then on the the second to the last bullet, the $1.5 million increase for Shelton Innovative Affordable Housing, that was actually a $3 million project in the 2018 capital budget under the Housing Trust Fund. And they were able to increase that by $1.5 million. And so that's why it says $1.5 million on that. But it's actually a $4.5 million project.
Deborah, that's related to the veterans tiny homes? That's correct?
I am not positive. I know that there was something in the proviso language about veterans, and I see Commissioner Trask nodding her head, so I'm guessing, and I know that that was a high priority for Senator Sheldon also. Yeah. So
yeah, that's my understanding, that it was for the veterans tiny homes.
Great.
And in the next slide, the transportation budget.
But don't forget our last bullet, Deborah. The 500,000 that we got for our welfare.
Sorry, Mark. Thank you.
That's right.
The $500,000, that was actually in last year's capital budget, but it was not an allowable fund source, is my understanding. And so rather than just losing that, they actually transferred it into the Public Works Assistance account. And so you still have that $500,000.
And I think the backstory on that one is that they wanted to fund it through CARES, and CARES is not for debt payment. And so they could not do it through that. So they went through the Public Works Assistance account.
So I've already have received communication from the Department of Commerce that we're going to be seeing paperwork coming. And I've also touched base with our county treasurer, Lisa Frazier, to see what would be the best use of that. So be prepared. We'll be bringing some more information on that in the next week or so.
It's good news.
Yeah, thank you, Mark. And then on the next slide, in the transportation, the supplemental, there was a $12 million increase for the State Route 3 freight corridor, which is great. And then on the new law, the 16-year plan, not in the Climate Commitment Act bucket, but the other bucket, there is over $74 million for the SR3 Gorst area widening and $35 million for the SR3 Belfair area widening and safety improvements. Now, the Department of Transportation is in the process of programming out these dollars over 16 years. And so I highly recommend that you start, and I know they've already started on this, so that you, if you haven't already, working with your WSDOT representative to talk about which bienniums you can spend that money and any criteria that would help you get preferred funding for that, because there's going to be a lot of competition in that 16 years to get that money first. And so if you have a Gantt chart or a capital facilities plan or something like that, where you've already broken it out into, you know, we need this much money, this biennium, and if we can get it here, it's because it'll save us some money. There'll be economies of scale because we're doing, you know, that kind of thing. So you're going to need to get that information to WSDOT so that they can program out the 16 years by biennium and then take that to the legislature next session for them to approve that. Okay.
Loretta actually had a meeting with the maintenance folks from the Department of Transportation last week that I was able to attend, and really good relationship there and working together with our partners at the Department of Transportation. I'm looking forward to meetings that we can have in the future with the construction side of the Department of Transportation. I think that this is an area within our county that really does need some assistance, and I think we all see the challenges that are facing them with transportation in that area. And so absolutely would love to work with the commissioners to kind of get a clear message to DOT as to what is the prioritization and the staging of how these projects move forward, specifically the freight corridor and the widening of State Route 3. And I've just kind of been thinking about how do you plan those, right? I mean, if we're widening State Route 3, I would sure love to have the corridor there first to provide an alternative means of transportation, but definitely want to start those discussions early, and hopefully the Department of Transportation can prioritize those to come earlier than 16 years from now.
And if you have things that you could speak to in terms of serving underserved communities and things like that, those are criteria that they're going to be looking for as they appropriate those dollars. Okay, and then on the next slide, so we want to, of course, have meetings with our delegation and talk with them, thank them for all of the hard work that they did for us, and start thinking about next session. It's going to be a biennial budget year, and who knows what COVID's going to bring next year, but we're hoping that the good revenue numbers keep coming and that there will be opportunities. So really want to start talking with our delegation as soon as possible about what the county's priorities are, and capital, transportation, policy, things like that, and start talking with them about getting their support for those. On the last slide, for the 2023 session, we know that the state tax structure work group is going to be coming back with recommendations and legislation in 2023 to rehaul the state tax structure system. So definitely want to be keeping an eye on that and looking at that. Maybe they'll lift the cap, the 1% cap for local governments. I don't know what they're talking about, but hopefully we'll see something. They actually have a meeting coming up on the 30th of this month, so maybe they'll give us a little preview. And then you can see the list of legislators that we know are leaving their positions, and of course, all of the House is up, and then half the Senate. And so we'll see what kind of changes that brings. But there's going to be some change in the body of the makeup of the legislature next session. I also just wanted to quickly mention a bill that I know that was important to the county that did not pass, and that was House Bill 1333, the Rural Public Facilities Tax Bill. There was a lot of discussion about that. We'll see if we can get any traction on that next year. The auditor's office is going to be coming back with some additional information, so hopefully that will help give the legislators that were concerned with transparency some more information on that. But in the meantime, Senate Bill 5868, which also is part of the 0.09 tax, expanded the use of that tax for affordable workforce housing. And so I don't know if that's something that the county can utilize or not, but I wanted to put that on your radar. I believe it can be up to 120% of the area median income. So if that's an issue, if affordable workforce housing is an issue for the county, want to take a look at that and see if that's something that you want to use your $0.09 for. And with that, Mark, I'll turn it back over to you. And in terms of when we want to get together and talk about priorities and things like that. So I'm happy to meet with you whenever you want to do that.
Well, thank you, Deborah, and thank you for the excellent, consistent communication that we received from you through this last session and the support that you gave Mason County. It felt really good to have a partner there to represent us and really work with folks to not forget about the small little county to the west of Olympia.
Thank you, Mark. And you were great to work with too. You were always right there. So I appreciate that.
there any questions that the commissioners have, Commissioner Schutte?
No questions. I'll just say to Deborah, thank you so much. I think it was a really successful first session working with you, and I think the sky's the limit for the amount of opportunity that we can bring back to Mason County. And of course, as you mentioned in your presentation, we have to absolutely thank and tip our hat to Senator Sheldon for his years of service and contributions to Mason County. Just always so instrumental on transportation and his work over the years to not just get the freight corridor funded, but to get the additional funding in under the supplemental budget this year. We're just really fortunate to have such a seasoned and experienced delegation, and I'm sure that's going to continue for us into the future. So appreciate all your work this session. Hope you get a little bit of a break.
Thank you.
I'd also like to say thank you, Deborah. You did a great job. To the commission, I'd like to throw something out for you to consider again. I've been an advocate for years of having somebody in our office that is working grants on a constant basis. This year's legislative budget shows that the opportunities are great for those counties that already have that in place. I'm going to ask you now to please consider doing that and consider asking Mark to bring us forward some type of options of what we could look at to put something like that in place as soon as possible. I'd hate to not be the one at the table during this opportunity for money flowing for so many different things such as housing and mental health and et cetera, et cetera. There's just so much I'd love to have us take advantage of if we can get that opportunity.
Real quick, I'd like to thank Deborah and Mark. I think, I know it was great working with you two during this session. You guys made my life a little bit easier. Deborah joining me in the WASAC Legislative Steering Committee meetings was so helpful. You guys are just great to work with, and I feel lucky to have been a part of that team. So,
thank you.
Great. I think that's all we got for you, Deborah. Thank you.
Great.
Excellent.
Okay, I'm going to jump right into my next briefing item, which is an update on Building 10. So Building 10 is currently in Phase 2. Phase 2 is our exterior improvements. As I've heard, a lot of individuals have seen that there hasn't been a lot of work going on around the exterior of Building 10. And that's for good reason. We had to go back and kind of take a closer look at how we're going to do some of the road improvements, working with the city to make sure that we're coordinated on that effort and that we're all under the same understanding of how we would move forward. And so I believe that we are there now. I'm super excited that our construction company, Cobos, can be out here as early as tomorrow morning, but definitely wanted to brief the board and kind of give you an overview of where we're at. So the last time that the board received or approved a budget for Phase 1 and Phase 2, it was at $3.3 million. Since then, I've provided you a list of change orders that have occurred. The county administrator has the approval to exceed the approved budget by 10% on these contracts. So you can kind of see the changes that have occurred since. I approved PCCO 13, which was specifically associated with some curb planter replacements and additional demolition and concrete work that was done around there for about $59,000. And now I'm approaching that 10% and wanted to give the board an update of where we're at and request that I put it on your regular agenda for the 29th to increase the cost of this project, or the budget for this project, to $3,730,000. So be happy to answer any questions. You do see that on the bottom of that list there is PCO 72, 73, and 74. I have actually not signed these as of this time because I wanted to get some feedback from you all before I moved forward on that and make sure that we were all on the same page.
Mark, assuming that we do approve these because we're into this project and we want to see it completed, they can get out here tomorrow. Do they have an updated timeline on when they might be able to complete the work now that we're over some of these hurdles?
They do. It's just a matter of when they start, right? And also the weather permitting some of the work that they have to do. Is we've replaced a lot of what was proposed to be done with concrete with asphalt. And so asphalt is a little more easy to work with, I think, with the weather as opposed to concrete. Concrete can be very, very weather dependent. So I can get you an updated schedule as soon as I give them a date to return. If we're all good with this, if you are all good with this, then I can actually contact them as soon as our meeting's out and have their demo crews here tomorrow morning, and then I'll get you the updated schedule for what that looks like. But I'm hopeful that over the next 30 to 40 days that it could be completed.
Okay.
Mr. Chair,
Yes,
Mr. Chair, I'm supportive of him moving forward and supportive of it going on to the agenda.
Commissioner Trask?
Yeah, me too. It'll be nice to have it completed, and I'm sure that Safeway would love to have their entrance back.
I would love to have the barriers out of the street and individuals able to drive down Fifth Street again. So I'm really looking forward to it, and I feel like Kelly Frazier and I are definitely ready to jump right in and make sure that this continues to move forward as planned.
Not a week goes by that I don't try to take Fifth Street from Railroad and have to go around. So very much looking forward to that too.
Yeah. I've become very accustomed to the roundabout.
Yeah, great.
All right, our next item, it looks like, Deb, are you going to present for Becky or?
Yes, I am.
Okay.
So good morning, commissioners. We are looking for approval to place the International Public Management Association for HR Master Services and License Agreement onto next week's agenda. So as you know, we've had some discussions about staffing within the jail. So this is an opportunity for us to bring some of that testing in-house and proctor those tests, and also do the physical ability tests, having the sheriff's office perform those for us. We want to run it on a trial basis and run at the same time as our public safety testing, and see if it actually saves us any time. And that was the concern, was the length of time that it takes for some of the public safety testing to get through that process. It's been presented to the Civil Service Commission last Thursday evening, and they approved that. And so again, just looking minimal budget impact, under $1,000, and there is civil service budget to cover that. So we would like to place that on next week's agenda for your signature and approval.
Great. All good with me, commissioners?
Oh, very, very much.
Commissioner, you're muted.
100% supportive. Let's hope it really speeds up the process.
Thank you.
Excellent. Thanks, Deb.
All right, well, that's all I had for you. I think Auditor McGuire is here and ready to present some stuff on redistricting.
Good morning, commissioners. I have two highly controversial items. The first is precincts. As a result of the number of new voter registrations we received for the presidential election 2020, we had 8 precincts exceed their legal limit of 1,500 registered voters. What we did was take a look at all the precincts that have more than 1,250 registered voters and have split them, some as full splits, some taking 2 precincts and turning them into 3. The result is we worked very closely with Richard Diaz at Public Works, who was just awesome to deal with. The result is a proposal to go from 43 to 55 precincts. Precincts used to be a bigger matter when we had polling places and when election officials used offset printing and they didn't want to print a lot of ballot styles. With optical printing, it doesn't really matter anymore. that's the proposal in a nutshell, is to excuse me, to go from 43 to 55 precincts. You have in your packets a proposed map and a list of the precincts and the number of there is one exception to the cap of 1,250, the arbitrary cap that I chose of 1,250 voters, and that is the Lake Cushman precinct. We were originally down to around 1,100, and the lines got really goofy, and so we straightened out a bunch of goofy lines, and it's at 1,268. But that's the only one. That will be the only precinct over 1,200 registered voters. So my recommendation, this is a commission act. I believe last time we did this in 2019, you did a resolution. And so the timeline issue here is that because we have filing for precinct committee officers on the third week of May, the 16th through the 20th of May, this needs to be done by law 2 weeks before that. So this needs to get done in April. The deadline is May 2nd to get that done. So that's item one.
Okay. Is that set up to a hearing?
I think that's a Diane question, not a Paddy question.
I think that was a dying question to Paddy before she left to find out, but I will look. When I looked when we did it before, it didn't look like we did it via a hearing, but I will make sure. Definitely it's a resolution.
Yeah, I think it was just by consent agenda action.
Correct.
So whatever the process we followed in 2019, I'm comfortable following it again to add the additional 12.
Yep, same.
Okay, great.
Okay, I'll work with Paddy and we'll figure out what we need to do for the 29th.
Awesome. Second item is I have the statutory authority to adopt administrative rules related to the county voters pamphlet. We did this originally last year. We've now published a couple counties voters pamphlets and learned a few things, and have adjusted the administrative rules. I adopted those last week by law. I have to present the commission with a copy, and so I am doing that. So you don't need to do anything, I think, other than receive the copy. Just by way of explanation, we split this into two documents, one for candidates, one for measures, to make it clearer, particularly for candidates who aren't going to have to use this as often, what they need to pay attention to. And no big substantive changes except related to the pro and con committees for measures. We've plagiarized from Whatcom County to make it more clear that this is the responsibility of the districts to appoint pro and con committees, rather than just passing it off to the auditor.
Great. Commissioners, any questions for the auditor? Okay.
No questions, comment. Thanks for the copy.
Sure. You can have another one if you want.
Thanks, you're too kind.
That's all I have.
Excellent. Very good. Thank you, Mr. Auditor.
Thanks.
Appreciate your time.
Auditor McGuire, I was glad to see that on the content rejection and appeal process that you expanded your language of just not allowing obscene, because obscene is a pretty high bar to meet. So allowing you to work with a candidate that might be presenting something libelous or otherwise inappropriate, I think gives you the authority to make those recommendations for changes.
Yes.
Good job.
Thank you.
Mark, you have a little familiarity with these things, don't you?
I can tell you that my definition of obscene versus the definition in state law is two very different things. So yes.
Thanks,
Excellent.
everybody.
Thank you. Take care.
Bye, Patty.
Okay, commissioners, are we good to keep rolling or do you need a minute?
I go either way.
I'm good. Keep going.
Okay, all right. Move on to community services. Dave, are you with us? Kel?
Dave is
Kel?
out. Yep. Dave's out today. And so I'm going to kick it off with Alex.
Morning, Commissioners.
Morning.
I'm bringing our contractor application back this week. As I explained on the briefing sheet, I have looked into the concerns from last week that you guys had regarding his place of residence. He also provided some more information that I believe helps support his application. We can continue the discussion. Otherwise, we're hoping to move forward with this.
And I think Tim weighed in and said he didn't have an issue with it. Is that correct, Mark?
Okay.
I'm supportive.
Yep, same.
I am
Great.
as well. Thanks, Alex.
Thank you.
Thanks, Alex.
Next, we have Melissa. Oh, you're muted.
Where I press that button. Good morning, commissioners. I am bringing five applications for the Heritage Grant 2022 to you guys to put on the action agenda for the 29th for approval, and a total of $8,700 from the Historic Preservation Commission. Forgot the word for it. Financial.
And this is seeking approval on those applications?
Yes.
Okay. Commissioners, do you
Chair,
have
I'm
any?
supportive.
Okay.
Oh, absolutely. These are some great institutions. So awesome.
Yeah, I'm supportive as well. Thanks, Melissa.
Thank you.
Commissioner Schutte, can I interrupt real quick? I apologize. I shook my head too quickly before I really read through that. I have talked with Tim on a number of different items. I'm going to verify that I talked to Tim on this one. I know that I talked to him about somebody that was applying to, I think it was the library one is the last one I could remember, where that individual is planning on moving into Mason County. But I do not believe that there is a legal issue associated with this, but I don't want to pretend like I 100% know that I've talked with Tim about that. So I will get back to Commissioner Netherland on that.
Well, can we say it this way then, that if hearing no objection from Tim, that we continue to move forward?
Yeah, I would be good with that. And then also for the Area Agency on Aging, if we could check on that one too and make sure that that one's good to go.
I think that was the one that Tim cleared.
Yeah.
Yep. So I think we're good on Agency on Aging. I think it's this one we just maybe want to get another confirmation on, which is okay, but we can do that in the interim there. Okay.
Sounds good. Thank you.
All good. Okay. Commissioners, anything for Cal or Alex? Okay, perfect.
Hey, I did want to say one thing. So quite a while ago, several months ago, you guys gave approval for us to go out looking for a fire marshal more than the 1 day a week that we have with Mike 6. And we are now finally ready to do that. We've been ready, but we finally are putting that into place. So I'm just giving you a heads up. We're going to post that position.
Fantastic. That's really great news.
That's awesome.
Yeah.
Good
Yeah.
job.
That's all.
Great. Okay. Next up, we'll move into Public Works. Loretta.
Morning.
Good morning.
Let's see, get a video going here. Okay, commissioners, first up, we have a request for a sole source purchase. And this is for some UV lights up for our Belfair facility. And you may recall that we've been making a series of improvements up there and aimed at improving our reporting and meeting our monitoring requirements with Department of Ecology. And Justin will be happy to give you some more details about this sole source purchase.
Good morning, commissioners. Sorry, some reason I guess my video feed's not working, so lucky me. So yeah, just like Loretta said, there's a couple of things that we're looking to get approval for. And basically, as far as the executive summary is the Bellfire Water Reclamation Facility. It needs some ultraviolet radiation as far as the UV bulbs. If those of you who are not familiar, the UV is a part of the disinfection process for the treatment plant. It activates the bacteria and viruses that are still present in the effluent. And that's already gone through the treatment processes at the plant. In 2021, Belfair's reclaimed water facility received a number of permit exceedances for the effluent total call form. And we actually had a field technician come out from Trojan UV on November 3rd and 4th. And since his inspection review and basically kind of troubleshooting the system, we actually have not had a violation since then. So that's been really great to have him come out and help us out there. And basically his findings that he had there was a number of different components that are needed in the UV system, and in that is the quote that is attached there for a total of $31,146.72. And basically the components that he discusses and goes over is something that is needed for Trojan UV or Trojan technologies to back the UV system. So with these, and once they're installed, they're guaranteeing that the plant will perform, or the system itself will perform as needed and disinfect the water like it should.
Great. Commissioners, any questions for Justin?
No, I'm supportive of going forward. I think this is vital. This is keeping our plant going.
Yeah, excellent. I am as well. Great. Next.
Thank you.
Okay, next up, commissioners, we have Mike to present several of the annual certifications that are necessary for maintaining our standards of good practice with the County Road Administration Board.
Good morning, commissioners. We've been reporting to the County Road Administration Board several different processes through the last month here. And among those, we have the annual certificate for 2021, the certificate of expenditures for traffic law enforcement, and for fish passage barrier that need the chair's board signature. So these are due April 1st. So if we can get them on next week's agenda, that'd be great.
Okay, I'm supportive, commissioners.
Same.
Yep, me too.
Great, nice work, Mike.
Thank you.
Okay, next up, we are preparing to move forward with one of two fish barrier removal projects that are on Uncle John's Creek. And the two projects are referred to as Upper and Lower Uncle John's Creek. And the Upper Uncle John's Creek, we just had a bid opening. Is that correct, Mike, on Friday?
Yes, we bid open. We had 8 bids, and the low bid was about $291,000.
So we're excited to get that project moving this summer and off the books and helping to make the fish happier and making a safer driving experience. And then on the Lower Uncle John's Creek, we have some options here about how to proceed forward. And Mike's going to present a couple of those options and an outline of what we're proposing for community outreach around this particular project.
So yeah, we had Brian Abbott Fish Barrier Removal Board, and we had an award to design the agate loop rope, the Lower Uncle John's Creek culvert. So we came up with a couple different designs. One was just to plain replace the culvert, and working with Fish and Wildlife, they're requiring a bridge, more like a 65-foot structure to go in there. And then the other would be to actually remove the culvert itself and create roundabout or cul-de-sacs at the end of the approach, and basically dead end the road partially from each direction. We've contacted the local residents right there immediately on the road, and they're not against that process, but we obviously want to reach out to a larger community and find out who's using the road and what their concerns would be. So we're not saying, we're dead set on either process one way or the other, but there is a timeline we have to meet to apply for the construction funding. So we'd like the board to direct us to hold an open house April 4th at the Agate Grange for a public community meeting, and we can start the process. You can see the other dates we have timelined on the briefing package there.
Great. Commissioners, any questions for Mike or Loretta on that?
Very supportive.
Supportive as well, and I want to thank you for taking me out there and showing me. I'm more of a visual person, so that was great. I appreciate that.
It always helps.
It does.
Excellent. Well, I'm supportive as well. Look forward to more updates as they come available.
Thank you.
Thank you, commissioners. And now the presentation of the annual bridge report.
I will do a summary of this, and if you have any more detailed questions, we can definitely address them. So I'm here to present you with a 2022 annual bridge report. The report is a requirement of the WAC code and the County Road Administration Board. A brief summary of our structures. We currently have 69 structures. 47 are concrete, 9 are timber, 5 are a composite between concrete and timber, and then 7 metal culverts, and then 1 concrete structure we inspect for the city of Shelton. And so that's a lot of bridges to take care of. So all the bridges are required to be by the FHWA to be inspected at a minimum of every 2 years by a certified inspector. The process for certification and inspection is you have to be a PE, and you have to pass a 2-week course of training, and there's a couple other processes, but it takes like 5 to 10 years in the other processes if you don't have a civil engineer's license. So it's quite intense operation. There's continued education that has to go along with that. And so it takes a lot of effort to keep up your certification. So we look at each bridge, and they rate them by sufficiency rating. Basically, it's a condition rating of the bridge. The rating is a 0 to a 100, 100 being a new structure. We currently have, and I know I'm throwing a lot of numbers out, and I could be more detailed later if you need to, but we have 39 structures that are rated above an 80. So they're in basically good shape. We have 28 structures that are between 50 sufficiency rating and 80. And so they're, it's not as good a shape, but they're still going. That only leaves 2 structures that we have below 50. So Stretch Island Bridge is 1. It's a rating of a 43. And Harstein Island Bridge is 1 that's rated at 27. And that's basically because of the deck on Harstein Island Bridge. So a few notable structures are, 1 is the Stretch Island Bridge. That's the only bridge that is posted for load restrictions, and that's why the rating is low. We're going to look into trying to apply to the BRAC or to the funding board for some either repair work or some replacement on that structure. Harstein Island Bridge is currently funded at $3 million for a deck repair, and that's to be constructed here in 2022. A few other repair jobs that we've got lined up is North Fork of Goldsboro Bridge. We're going to be replacing one of the pier caps that is rotten. That's going to be under contract in 2022. Vance Creek Middle Bridge. It's going to be repairing a damaged girder that was done some years ago by some log jams on the Vance Creek River. That's going to be also done in 2022. And we're also looking out for the future here, Eddie Evers Bridge. It's the timber bridge that it's got some rotten spots and needs some paint repair. And so we're going to have that done in 23. The overall number of bridges has expanded this year by 2. We added Homer Adams and Highland Dayton structures. Those were constructed by county forces last year. Later this summer, we're projecting to construct 3 additional structures. Their Uncle John's Upper box culvert will be done by contract, and Katy and Great Bend culverts, their box culverts that meet the bridge requirements will be done by county forces work. So we're going to be adding another 3 structures for next year. So it's a expanding responsibility, but we're taking care of it.
Excellent. Commissioners, any questions for Mike? Okay, great. Great work as always, Mike. It's good information.
Thank you.
That is about it, commissioners. I do want to echo the comments from earlier during Mark's briefing about what a great experience it was to work with Deb and Mark and yourselves during session, and it yielded great results. So many thanks, commissioners, for your work. And now we've got some work to take a look at how to program those monies. We need to bring back a look at what changes might be available for funding some of the projects now that we've received the legislative appropriations, and setting up time with our partners at DOT to make sure that we're on track and on schedule and pushing ahead on those state projects as well. So again, thank you very much. We also received, I think Commissioner Netherland, you mentioned also earlier the need to keep an eye on grants and have a stronger presence in the grant process because of all of the additional federal funding that's coming through and the state programming. One that just came through was an additional $200,000 in our CAP program, around 200, right, Mike?
Yeah. Yep.
So that's administered through CRAB, and that's to go towards preservation. So that was one of the APWA and Association of Counties priorities, was an emphasis on the need to make sure that maintenance is adequately funded. And a 10 million total was appropriated throughout the state. And this is our $200,000 cut of that 10 million. Any other funding items, Mike, in terms of on the transportation side? We certainly have the 2 connection points on the freight corridor that we will be working with DOT on. And then also the SR3 widening. And I guess the other is the RAISE grant. We need to be working closely with our folks over at the EDC and others to make sure that we're looking at the economic side of things. And RAISE grants are highly competitive, big number grants, and have a benefit cost analysis that is associated with it. So we will need to be sharpening our pencils in that regard.
Well, I'll just say, you guys are always really good at, sometimes at the elected level, we're very excited about new projects and funding new things, and you're all very diligent, whether it be at our in our public works shop or talking to friends at DOT about how important it is to fully fund maintenance and taking care of the inventory that we do have. So that's an important emphasis, hopefully, that the legislature also remembers going forward.
Oh, and one last item, commissioners. Mark mentioned also earlier that we met with our partners with DOT on the maintenance side. And one of the items we discussed was litter pickup. And DOT was happy to announce that they are re-engaging with the youth corps. And now that COVID restrictions are lightening up, they still have some restrictions, but they're able to step up the litter pickup on the state rights of way. So that was good news.
Excellent. Great. Commissioners, anything for Loretta or Mike?
No.
Okay. Thank you.
Right. Thank you, commissioners.
Thank you, guys.
Okay. I think we've hit the end of our agenda. Commissioners, is there any discussion? Okay. I just have one item to raise to the board, and I guess maybe even more appropriately to Diane and Mark. I know Diane and Mark have been compiling a list of authorities for the administrator for us to consider, and I want to maybe have us have a check-in on that in the next week or two, just to do some cleanup so that we're in line with code and the job description. So I don't know what kind of opportunity you have to turn that around in the next week, but in the next couple of weeks, I think we should have that conversation.
I think that's a great conversation.
So, okay. If there's nothing else, I would entertain a motion to adjourn.
So moved.
Second.
Been moved and seconded that we adjourn. Any discussion? Hearing none, I'll call for the vote. All in favor, say aye.
Aye.
Aye. All those opposed, motion carries. All right, see everybody tomorrow at Board of Health.
Thanks.